Hi friends, welcome back to Coffee with Ravi. I know that I've taken somewhat of a break, but I want to get back at it so that we continue to share this information so that you can feel somewhat empowered to take care of your own health. So today I wanted to talk about anal fissures. Many times patients call me saying that I have a problem with hemorrhoids, and hemorrhoid is the word that's out in the terminology. But many times it's not that, it can be a fissure. Now, the difference between a hemorrhoid and a fissure is that a fissure is literally a cut, similar to a cut that we can have on the corner of our lips. It's only around the anal canal. What I have here is a photograph of the anal canal, and the anal canal is a area where the skin of the buttock, right around the anal opening, meets the rectum. Right there, the skin becomes a different type of lining, and it's in this anal canal lining if there is a cut it's called fissure. An acute fissure is where there's a cut that's lasting for a week or less, but as it continues, it becomes a chronic fissure. These can be painful for two reasons. There's some decreased blood supply there, and also the spasm of the muscle of the anal canal. That's what causes the pain. So what causes this cut? A cut is caused either if there is a big stool that's hard or constipation. Sometimes it can also occur with diarrhea. If there's a lot of stool there, the irritation, etc., can cause the cut or a fissure. There's a condition called inflammatory bowel disease, Crohn's disease, or less likely ulcerative colitis that can cause that fissure. And sometimes it can happen after vaginal delivery. The symptoms are very characteristic. There is pain. The pain can be there, sometimes exacerbated after having a bowel movement. Sometimes there can be some blood. And as mentioned, the symptoms are because there's decreased blood supply. When a trained gastroenterologist or a nurse practitioner looks at that area, what we see is a little small amount of a skin tag, and sometimes the edges of the fissure can become more chronic, looking in a chronic fissure, and that's how you can tell. Many times it requires wearing a magnifying glass to look at it. The treatments are varied. Acute treatment can be just kind of rest by making the stool soft, increasing water intake, adding more fiber. There's 2 or 3 different modalities that we use. There can be a cream that has nitroglycerin in it, or a cream that has nifedipine, which is a calcium channel blocker. Both of these relax the muscle, allow the blood to flow there, and allow the fissure to heal. With the nitroglycerin, sometimes there can be some headaches, and with calcium channel blockers, there's less of the side effect, and the results are promising. And sometimes we use a combination of that along with a medicine called hydrocortisone. If that doesn't work as a baseline treatment, what we do in our practice is inject Botox. This is with a camera. We take an endoscope, go in there, inject Botox into the underlying muscle or the sphincter, and the Botox relaxes that sphincter for a period of time, allows increased blood supply, and allows healing of the fissure. Sometimes a surgery is needed. It's called a lateral sphincterotomy. In other words, surgically, you're cutting the sphincter. Occasional side effects with that can include fecal leakage, etc. So we use that as a sort of second line if the medications like nitroglycerin and nifedipine don't work, or Botox doesn't work. But really, in summary, hemorrhoids and fissures are different entities. A fissure, sometimes they can be skin cancer that masquerades as a fissure, so we have to be very careful. A thorough trained exam by a trained professional is important before we label it fissure or hemorrhoid. Treatments include nifedipine cream or nitroglycerin cream or Botox, or sometimes surgery. So keep thinking about this, and I hope this gives you a little bit more information about anal fissure. We'll continue to talk to you every few weeks. Thank you.